Hello and welcome to our Friday webinar. We are back with Dr. Tully for another great session of Ask the Vet. Welcome.
Oh, yeah.
Welcome. Is it Mardi Gras in your area?
It was. It's the austere period after Mardi Gras of Lent.
What does that mean?
That means that you have partied and that you are fasting and you are giving up something prior to Easter.
Yes.
And so that is the partying of Mardi Gras ended on Tuesday prior to this period of reflection. To the best of my knowledge is how I define it. I'm sure some of our listeners have probably better description, but that kind of puts it in place and why everybody parties before this. And then so you party yourself out for 40 days and then you pick up after that. But also it's a nice time after Christmas to continue the festivities over winter, right?
Yeah.
So we really have no, and then after Easter, you go into Jazz Fest, and there's always a party in Louisiana.
Just continuous, huh? And you had the really cool cake where you get to cut it and see if you get the baby, right? Is it?
Yes.
Nice.
But anyway, good to see you, Laura, and I hope everybody's having a great new year as we go into 2023.
Yes, it's have we had a webinar for Ask the Vet yet this year? Is this our first?
I don't think so. I think not. This is the first one because we have a couple of big veterinary conferences during this time. We have a big veterinary conference in Orlando, VMX, and promoting the Lafeber products to veterinarians and making sure they are aware of the benefits that they can have on their patients. And then just got back from the Western Veterinary Conference in Las Vegas. And yes, and so a lot of people, a lot of veterinarians learning, and a lot of new stuff. Exciting. It's always exciting to see all of the new developments and promotions and products out there that help us do what we do.
Very nice. Yeah. And speaking of Lafeber, I mean, check this out, 50 years of Lafeber. It's our 50th anniversary.
Wow. Cool. Yeah. See the little sunshine logo in the
back. Yes.
back.
Right. Celebrate nothing.
50 years. Boom.
Oh, wow. Yeah. That's a lot. I mean, that's a lot of healthier birds out there because of having healthier diets, right?
Yes, ma'am. Yes, for sure.
So I'm sure once again, we're going to have some interesting and questions. So maybe we'll have one that will stump the vet again this session. Let's see.
I'm sure there's there's more than that. One out there to stump me.
All right. So if just a reminder that if you have a question for Dr. Tully, to use the Q&A button and not the web chat button, because that way we can capture it. And so let's see what we get for our questions. And just real quick, so was the avian flu a big topic at any of these? I mean, that's kind of a big deal right now. With
yes, it's been
egg prices at the grocery store. Seeing a trickle.
Yeah, it's been a big problem. That's for sure. I was just thinking about something that I can't remember exactly what it was that died at one of the zoos in the country. It was just on the AVMA, American Veterinary Medical Association kind of newsletter. I'll think of it, but nonetheless, we're prepared for it. It's out there. It is highly pathogenic. It kills a number of different bird species, problematic. We have had it here in Louisiana. We're a major flyway, so there has been incidents of wild ducks kind of exposing ducks that are native and have and normally inhabit this area, resident birds. But for the most part, I think people are aware of it. Most people are aware that and have maintained a barrier for their companion birds, and we have seen and for the most part birds that they have around the house, although it's difficult. But we have a protocol in place. We try to with signs, respiratory signs, neurologic signs of birds with a wildlife. We have a wildlife hospital here, so we get any number of different bird species that you're going to have: hawks, owls, pelicans, cranes, egrets. And so anything we try to give a barrier and try not to get them in the hospital to expose other animals. We have a protocol, protect our people and the patients, and so we can do anything that we can. And we're doing a lot of testing just to make sure that they're either positive or negative. And so far, we've been very proactive in maintaining this protocol, and we haven't had any issues here. I can't really think of a positive that we've had. We've had some that we were suspicious of, but the testing has come back negative. But this is a major issue. It is not something that's unusual in history. We have this highly pathogenic avian influenza. It morphs the virus, and so you have this different strains that come up for the lack of just the people understanding. You have variants, just like the COVID, you have the Omicron and a variant and a number of other Greek alphabet names as far as variants. And so you have, and in the avian influenza, it's identified by surface proteins. So that's where the H1N2, which is the letter that starts the hemagglutinin and neuraminidase are the surface proteins. So you have, and so they change, and that's why you have H1N2 or H5N4. So that's what happens over time. And I can even when I was in veterinary school in the early 80s, mid 1980s, there was a avian influenza outbreak. Millions of chickens were euthanized, and since that time, there have been, you can look back and see where this occurs, and of course, it's high on the USDA's radar, as about as high as it can go, and they test for any type of avian influenza problem out there that they see, any deaths of birds that occur and they identify it as avian influenza, they test for it. Their main issue, of course, is with the poultry industry. Poultry industry is a $46 billion industry annually. Okay, $46 billion. And so that's what they are looking to protect. And of course, they're concerned with the other birds, but they don't have much control of the birds flying out in the environment. But so some of the pathogenic avian influenza to one avian species isn't to another. So they always try to, so what the main concern for USDA is, as poultry industry, is they check to see if it's pathogenic to chickens or poultry. And if it isn't, then it's not a concern to them, because they know that it does have this change in its ability to become more pathogenic or less. So that's just a little bit more, probably more information than you were looking for, but it is a concern to a lot of people. But it does
Bird owners
go through.
specifically? Is there, like, if you have a pet parrot in your home, are there more people? I mean, is your bird at risk, or are there?
It's very possible. Yes. I don't recall personally hearing any birds that have had this particular, but I wouldn't be surprised if there have been deaths of parrots that are associated with this avian influenza outbreak. I know that there was a highly pathogenic avian influenza, I guess, variant that was going. I mean, this was about 10 or 15 years ago, and that there was a parrot that did have that and was identified with that. So this would be something that you'd want to be protective and be conservative on, and surely wouldn't want to try test your birds to see if it was if they were susceptible or not. But I would consider this a very pathogenic virus to any avian species. That's the way I would look at it, and that's the way we're looking at it here. We don't want to expose any birds here. Of course, we deal with sick birds, just like humans. Go to sick, you go to the hospital, but we're doing everything we can so there's no exposure, or at least or reduce that. And isolation, we have a whole protocol for that.
Okay, well, actually, we have a question about that. Linda wanted to know: is there a vaccine to prevent bird flu in chickens or any other birds? Is there a vaccine available?
No, not currently. Not currently. It takes a great deal of, as everybody knows, just with just to use an example, that's deer. That's happened within recent history, and the COVID vaccine, to see how long that it took. People are dying left and right, and then it took that period of time to actually have develop the vaccine. And you want to make sure that you develop it, and the influenza viruses, it's not necessarily the easiest virus to make a vaccine for that's protective. And as we all know, with the change in the influenza virus for us every year, and so there's so no, not at this time. I know that they have over the years. It takes a lot of development, and a lot of times by the time that it is developed, the virus is kind of waning in its effect on the population, avian populations. But I know that they did have a vaccine a few years ago with one of the highly pathogenic avian influenza viruses that they were concerned about being transmissible to humans and causing disease. But then again, when you're looking at this vaccine, you have the concerns that people have of vaccinating themselves. Humans have, well, the cost, does it work? What's it going to do to the bird? And so you have a segment that, you're not going to vaccinate anyway. And then with a lot of birds, it's cost. Poultry industry, a vaccine like that, it costs money. And so it's not very cost effective for them to have a vaccine. And to develop a vaccine costs millions of dollars in everything that's involved, even to get approval of that. which is why we don't have more vaccines for our companion avian species. Why don't we have cytosine beacon feather disease vaccine? Well, we have a vaccine. Dr. Ritchie has the vaccine, but it's not commercially available because there's no company that wants to actually commercially produce it. So there's things like that. There's probably other diseases that we treat that we could have a vaccine for, but there's no company that's going to commercially promote that. And then there's the cost where a lot of people who have it aren't going to vaccinate the birds. So therefore, that's not worthwhile to even have a vaccine, you know? And so that's kind of a paradox that, you know, as we've talked about this, that it gets back to our parrots, our companion citizen species, that's why we don't have vaccines that we could have for some of these diseases that that we talk about.
Wow. Yeah, it all ties back to, I guess, the poultry industry, because that's where the I mean, some of the poultry medicine is kind of trickles into companion parrot medicine because it's the funding goes there, right? That's how we get here.
Yeah. Well, there's very few vaccines in poultry, you know, for poultry, but they do have vaccines for poultry on a production level. But you have to look at when they do that everybody vaccinates. You know, everybody vaccinates in the poultry industry. So therefore, you're talking about millions of birds all the time, because you know how long it takes for a chick to get to a broiler that you see at the Walmart, the little 45 days.
Wow.
So it's growing. And so they're boom.
Wow.
And you're talking about millions of, so the vaccines cost relatively pennies on the dollar. And that's how they're able to vaccinate. They can vaccinate, they vaccinate millions of birds, you know, whereas when you're talking parrots, how many, you know, and you know, it's like, well, you know, each person who owns it has to determine, well, do I want to or not? Where the poultry industry is like, we're vaccinating if it's for something specific. And like I said, it's not a lot because they make sure that they don't have disease, right? Yeah. So
anyway. Well, that's fascinating. I mean, it's timely and it's good to know all this because a lot of people are, you know, wondering how it affects their birds and how it's going to continue. And it sounds like almost like we kind of have to wait to it rides its course out for this.
Yeah.
Right.
Yeah, but basically be conservative and protect your birds. That's the main thing. And then also what we also talked about was sometimes, you know, the pet bird owners, well, why don't we need to develop a vaccine for this, or we need to develop a vaccine for that. And it's not going to happen. It's just not enough return for that. So we just need to be preventive at this point in time.
Okay. All right. Well, I got a non-avian flu question for you. It's from Debbie and Jerry, and it's about a conure, and they want to know, why would a conure shed its tail feathers? So just wondering if it's like what would cause suddenly a loss of tail feathers being shed by conure?
Well, I guess right off the top of my head, and the most obvious answer is that it, you know, something pulled the tail feathers, or you got the tail feathers caught. It's high, you know, that somehow something happened like that. If the tail feathers are quote unquote normal, Usually the birds aren't going to shed all of their tail feathers. The parrots, the conures are going to shed all their tail feathers at one time. But that's usually what would happen. And then I would also make sure that I looked at the tail feathers, if you have them, at the base of the tail feathers to see and make sure that they look normal and that they're not pinched or there's any type of a malformation of that feather shaft that goes into that follicle. So I would look at that. And so why would the tail feathers shed if there was some type of a hormonal effect that all of a sudden there was a burst of this, a hormone that caused it, like, boom, the tail feathers are shedding. Only affect the tail feathers and not the primary flights or the secondary flights or any other feathers. So my thoughts are that, you go like, I don't know, nothing went in there and grabbed those tail feathers. They just were all out all at one time.
Yeah.
Well, I would, again, watch the bird, make sure that if they did, come out, if they did come out, then you should have new ones coming in. And I would say if everything and the feathers look normal, all the other feathers, the bird's fine, that somehow that bird got those feathers caught or something happened. And I can tell you, if it can happen, it will happen with animals, unexplained, and they should grow back in normally if all of the other feathers are fine. But that would be my top thought with just the tail feathers coming out. And it's not uncommon for that to happen.
Okay. All right. Then we got a question from Zeb, wants to know, what are your thoughts of foreign material in pet birds, presumably from toys? So treatments and prevention. They worry about cotton rope, fleece, and plastic, metal, etc. So birds are ingesting these foreign materials.
Yeah, that's a good question. I've always said, as far as bird toys, there's not some oversight. There's no I guess good housekeeping seal of approval on bird toys, as so well. We put it in our lab and we've tested it out, and boom, we have the stamp on it. So I mean, I think anybody that has any birds are aware that, Lord knows, any type of material can be on there or within a bird toy. So you have to be careful. You have to be your own, just like you're an advocate when you go to a physician or a veterinarian. You're an advocate for your bird. You're looking for quality care for yourself or for your bird. You're looking, and that includes what type of what you place in that cage as it relates to interactive foraging toys, within the cage. So that you have to look at that. And what you said, cotton rope, yes, boom, automatically it goes to a rose-breasted cockatoo. I could remember that case where it was that soft cotton rope, plugged up the intestinal tract. So pieces of plastic, especially in, it's a toy for a budgie, but then it somehow gets in the parrot cage or the macaw cage. And so that's problematic, or any type of bird toy that has some type of a mechanical aspect within that. And I'm talking about like, electronic components even. I've seen those where it could just tear it up. So you have to, if you think that the bird can actually ingest part of it that's, that would be problematic, then it likely is. And so I would try to, you have to be kind of self policing on the toys that you purchase for your birds, because again, there's no good housekeeping seal of approval on safe bird toys. So that's a great question. Yeah. And I go to and see the different over the years. I don't know. I just look at that and there's nothing you can do about it, really.
What are the chances of a material like from a toy part, for example, passing through the bird, like in their dropping? Is that ever going to happen? I mean, you hear about little kids like swallow something like a bead and it shows up in their diaper.
Yeah. I mean, oh yeah, that can happen. That can happen. There's no doubt about it. And it does. I mean, we have birds that and we monitor that they somehow, and a lot of times, and I don't want to say it's because they an owner buys a toy that's bad, because for all of the toys we have out there, the number of birds that come in with toy related injuries from a bird toy is very few. I want to say that. I mean, it's not like, oh, well, here we go again, but it can happen. And so you want to just be aware if you have something that the bird may be focusing on or is possible to that's its personality, that you'd want to be careful there. But we don't see it a lot, but it does happen, and you want to be careful about that. What we do see is where the birds see something outside of their cage, let's say a die-cast metal toy, a pen, a calculator, or something like that, where they just tear it up and those parts are ingested. And of course, we talk about lead, and that is so common because there's so many different areas where the birds can ingest that. And like I've said before, people just don't realize how pervasive lead is within the environment in different aspects. And so we've monitored where they've ingested. And so, this right here, can you see this little?
Yeah. So it looks like a lead weight.
It's a little lead weight. And you see how on, I don't know if you can see how it's kind of got grooves in it.
Yeah.
That's from the bird. The
What?
bird did that.
What?
Yeah, so I saved that. And then I have another piece here, a lead piece. And you see, what is this? Who would think that's lead? But it is. And you can see on the edges where the bird kind of chewed it. You see how that is?
Looks like hard plastic.
So I just saved that just for reminders. But we'll see these lead pieces in the with the radiograph, and we monitor that, and we have to treat the bird. We chelate it to bind the lead so it's not toxic, or zinc, and then we'll monitor if there's pieces in the GI tract, so that we'll know that it'll pass those pieces. So it can ingest different parts of the foreign body, whatever it is, and they can pass that.
Wow.
Mm-hmm.
Okay, well, I gotta move on to
Yeah.
they're really good visuals right there. So Amy wants to know, okay, let me see if I could pronunciate this right. Any thoughts on asymmetrical colloquioplasty procedure?
So everybody's going like, what?
It sounds extreme.
Oh, I want one of those.
Oh, yes. Yes, I'm sure it's for vanity purposes only. No.
That's a great question, but everybody's going like, what? And my thoughts on it. Well, my thoughts are that the good Dr. Hugues Bouffrere, who was a resident here at LSU, published a paper on this, and for everybody here, this is a procedure in particular for cockatoos where they have cloacal prolapse. Most of the time with cockatoos where they have a cloacal prolapse, it's what we're coming to, and of course there's, as with all medicine, there's not like just one reason that this occurs, but what we found is that this in cockatoos, that it's hormonal where they are prolapsing their cloaca, where it comes out, and that's not good. And so the vent and the cloacal tissue is protruding out of the vent. It gets dehydrated, irritated, inflamed, and it's just and the birds are straining usually. We can get this in other birds. We can get this in African greys too. And we have had this where we've done every diagnostic test under the sun, and even some of the birds we've been able to do post-mortem examinations on these birds, and there's no definitive disease condition that is causing it, bacterial, viral, anything in that category. So again, it kind of everything points to hormonal. For the cockatoos that we, especially the female cockatoos, we have had the ability. Dr. Avery Bennett, fantastic avian surgeon. He was a fantastic surgeon. He was a surgeon, but really had a very keen interest in companion exotic species, and in particular avian species. Has done ovariectomies, removed the ovary, the left ovary, and the ovary is very difficult to remove in a bird, and has resolved the issue in cockatoos. So there's at least anecdotal or clinical evidence that removing the ovary will solve the issue. However, the ovary, as I mentioned, is very difficult, and that's an understatement because it's up against the kidney, aorta, and many other major vessels, and like grapes, like a bunch of grapes up there. So we're talking about arguably the best avian surgeon in the world doing this, and there's a kind of a drop off from there, a very risky surgery. So then what do you do? Well, we believe hormonal in it, and the deslorelan implants seem to have an effect, but not for long, and not good enough. And so then you go into surgery procedures. So any type of surgery procedure that you do when you know that it's hormonal is like you're just treating the problem of the cloaca being exposed. You're not treating the underlying condition that's causing the problem, if you follow me. You're just putting a plug in that, but the bird's still hormonally going to really push and strain to get that cloaca out, okay, because that's what its body's telling it to do. So unless you reduce the hormonal activity within that bird to stop the straining, it'll strain, and it'll continue to strain, and it'll continue to strain to try to get that cloaca out, because that's what the body's telling it to do, no matter what you do. So the only way to really resolve the issue is to remove that ovary. In what we have, you know, what my opinion, that's my opinion, based on when I've seen birds, cockatoos in particular, that have had their ovary removed and have had significant issues with it. And then after the ovary's removed, no issues. So you go like, well, what about my question about the surgery and the surgery is a kind of a cloacal plasty, I guess. It's a where half of the cloaca is involved, and so not going to get go into the surgery here, but what my thoughts on it is that it is a surgery to prevent the cloaca from prolapsing, and it's kind of a semi cloacal plasty in which only half of the cloaca is involved, but it kind of reduces the pressure on that vent so that the cloaca can stay in place and the bird can still strain but will not prolapse. And so my thoughts are, knowing that the bird's still going to strain, that's the one thing you have to know, because you're not taking the hormones off of the bird, that you're not removing the ovary, it's still going to strain, and that it's likely to stay in place for a longer period of time, and who knows how long that could be. We can put a purse string suture in and just kind of, tie that little vent tight, but it can still defecate and urinate, which is important, but that'll break down. We can cinch up the cloaca internally, and we and we call that a cloacal pexy, and cinch it up against the ribs and keep it in, but it's still straining. And the only guarantee I have on any of that is it'll break down eventually. It may be 1 year, it may be 2 years. It's just like a beak prosthesis. You can put the beak prosthesis on a bird that's broken off the beak. It looks good. Any artist would say, woo, but the guarantee is it'll break off eventually. But it could last for years, but then again, it may last a week, depending on the forces and how well it's adhered. So my thoughts on this technique, that is that it's an option that I think is out of all of the options. It may give you, we haven't had the opportunity to use it here yet, but I would look at doing that as an option in the future, with the owners knowing that it I don't know how long it'll last. But from what the report, it was the article came out about a year ago in the Journal of Avian Medicine and Surgery, and Dr. Beaufrere, if you want to look it up, Dr. Beaufrere, Luc Beaufrere, was one of the co-authors on that, but I think he was second author on that. But there was about 3 or 4 cases that they described this technique in. But does that hope that helps kind of give an overview of the condition, and also that it is a surgery just to treat the problem. To treat the underlying condition, you have to remove that ovary. And that is just virtually, you always recommend something where when the treatments, where the disease is worse than the treatment. So you recommend that, and to actually do an ovariectomy in a bird, that's about that what I would be considered probably the most complex or difficult coelomic surgery to do. Yeah.
Okay, there you go. We're going to move on to pseudomonas. So they have a 25-year-old bare-eyed being treated for pseudomonas. Wait,
Pseudomonas.
Thanks. They have 3 courses of antibiotics. Understand we'll never be able to trace the source, but what precautions, like with cleaning products, etc., can aid in keeping his environment sterile? So they have him on bottled water. And they read that pseudomonas can live in cleaning products and also be on fruits and vegetables. So is soaking in vinegar enough for washing his foods? So how are we keeping pseudomonas out of his environment?
For the one thing, Pseudomonas is somewhat what we call a ubiquitous organism within the environment. So where is it? You never can tell. Pseudomonas is likes water environments. Actually, this was one of the bacteria that people have said, well, I have well water, that's it's great. It's not like city water. Well, the well water may be fantastic if it comes from the aquifer, but then it has to go through piping, and piping is an environment in which bacteria, we live in a world of bacteria. We have bacteria on us, in us, and so Pseudomonas like that. And so there was a lot of, I know of a few cases where there was people were using well water for incubation and raising birds, and it was Pseudomonas was all within that well water through the piping, and there was no, municipal water systems. They have chlorine in there that helps reduce the bacteria within that. But in a well, and if it's on the property, then nobody's testing or looking to see what's happened. So you have to be cognizant of that some of these pathogenic bacteria are in there. One thing that I would I would emphasize here is that you're not going to be in a sterile environment. We don't live in a sterile environment. But what you want to do is to try to maintain cleanliness, and so don't go overboard, but be recognize that being clean is important to reduce exposure, and not have and clean the birds on a regular basis, and also that you can't disinfect dirt. So surface to surface contact, you need surface contact with any type of disinfectant. But again, most of the time that there's any type of a bacterial infection, like a Pseudomonas infection, you identify it, you treat it, and then the birds usually recover from that. If there's an ongoing issue with that, then and the birds aren't recovering from it, then there should be you have culture and sensitivity. Make sure you're treating it with the right antibiotic, and then also, as you're looking, well, I don't want to re-expose the bird, but from what I don't see how and where you would be re-exposing the bird with the how much you're doing right now with the cleanliness on that. Then also I'd want to make sure that there's not any type of immunocompromised situation with the bird that would cause it not to either respond to the treatment or to continually get infected. Because I always say, if you don't have the immune system, your immune system is, I would say, 90% of what's going to, or more, in going to keep you healthy. If you're sick with a bacterial infection, an antibiotic is going to be significant, as we all know, to getting you well. But if you don't have the immune system, you can have all the antibiotics you want, and it's not going to be effective. You have to have that immune system, which is one of the reasons we talk about when you're looking at having your animal, yourself, but you want to make sure that everything's running on and your body, your immunity, and that's why nutrition is so important. That's why environment is so important. That's why the less stress you have, that's important, because everybody knows, well, I'm stressed out and I get sick, right? Well, birds are no different. And so we want to make sure that way. And so that helps reduce the onset of disease as much as anything. But no, the bacteria are within the environment. You can only do so much. And one of the take homes is you can't disinfect dirt. So if you don't have a clean surface and you put disinfectant on it, then it's not going to disinfect.
What about the vinegar? Is that something that we should be washing?
What's that?
The vinegar for cleaning fruits and vegetables. Is that effective?
It's interesting that you asked that. You look at and see some of these I guess different research and studies that they do, and they look at disinfectants, and I don't think that there's any disinfectant that gets all of the bacteria, that some are just better than others. And so I would say the best part of that is that if you're washing it with vinegar, at least you're washing the fruit or whatever. And so that's going to be a benefit there. As far as the bacteria, I have no idea. I wouldn't think that would, probably some bacteria would thrive in that environment. And I'm not saying it's the pathogenic bacteria, but there's some pretty, you talk about bacteria, they live everywhere in some pretty hostile environments. But anyway, the best thing is that the awareness and washing and trying to maintain a clean environment. And I think that goes a long way in maintaining the health of the bird. Yeah.
All right. So we have a question about Blue Front on Lafeber emerade omnivore. It's been on for 11 weeks via syringe, so 10 milliliters three times a day. He doesn't seem to have an appetite for his pellets. Is there a way to restore his appetite?
Well, my question is that what was he eating before? Was it just pellets? So my thing, restoring an appetite. I'm one. If they come to the hospital, whatever they're going to eat, I feed it to them. I want them eating. I want them ingesting. If they're, they're not coming here and I'm going like, oh, well, we're going to put you on this diet that's like you go to the hospital and they say, well, we're going to give you this diet right here. This is the perfect diet for you. And you're going to go like, oh, I wish I would have been eating that all my life.
Yeah.
That's
a low sodium diet or something.
No, I don't think so. I'm not going to eat this hospital food. And guess what? That hospital food is nutritious. They have figured that out. That's perfect for you. And so so when they come to our hospital, I don't do that because I want to make sure that those birds are eating or getting into that. If they need to have nutritional support, well, that's when they get the emerade, and we'll make sure that they get the nutritional support in that semi-elemental diet so they can digest it and get that. But if I want them to try to start eating, and if it's pellets, I mean, we definitely offer that, and we have birds that boom, they go right to that. But others that just like, they just ingest, and eat, our seed offering, because I'm just trying to get that bird eating. So if it was eating pellets and it's not now, then and it's on the emerade, the question is why is it on the emerade? What age bird is this again, Laura?
It doesn't say, but while we wait, maybe we'll get more info on that. But I was curious, is 11 weeks a long time to be on emerade? Is that part of the
Well, I mean, that is a fairly long time. We want to try to get the birds eating. One thing that you look at, and we'll get this, and we ask ourselves this question all the time too, when we are supporting our birds, and we're trying to get these birds to stabilize. We're giving them nutritional support. Well, we're providing all of that energy. It's like somebody's like feeding you, okay? And so you're satiated. So I'm not hungry because they just filled my tummy. Why do I want to eat? And so then I'm hungry. Well, they filled it again. And so if you keep filling up the bird, it's maintaining weight, it's the body condition, and you keep filling it up, well, it's never hungry, right? So, so it's and a lot of times, the birds may pick at a pellet and just tear it up, and just for kind of a foraging or entertainment.
Yeah. But
for the most part, they're going to go eat when they're hungry. And so that's one of the things, like if we're giving supplementation, we want to make sure that we kind of wean them off of the supplementation to get them back on the diet and see if they'll go and start eating again, if that's what they normally ate. Now, if they normally eat seed and you're trying to get them with pellets and, then I always try to get the bird start back eating what it liked, just to get back to the habit. And then once it's stable and back to normal health-wise, then start manipulating the diet. But I want it to be as healthy as possible when we start manipulating the diet to make sure that we have the best chance of having success with that.
Okay. Okay. So then we had an update. So just this from SG says just an update that doesn't require an answer, but their almost 33-year-old Nande Conyer had his 1-year anniversary since being diagnosed with lymphoma last month. In spite of having a very high white blood cell count, he's doing well on, is it Onsior? And he's maintained his weight, and overall he's happy. He's even a bit hormonal right now. So they just want to say thanks for your help and stuff. So.
Well, thank them for being such great owners and having great health care and overseeing that. And so this is an example of what can happen. You have a poor prognosis or diagnosis, but at the same time, this is an example of the advancement in avian medicine that we've seen over the last 30-40 years, and we're continuing to do so. And I'm so very happy. I really am. I mean, no answer, but I'm smiling. I'm happy for the owners and their veterinarian for everything that they're doing. Good.
Oh, that's awesome. Yeah, no, that's great. 33 years in Nande.
Yes, thank you for sharing. Thank you for sharing.
Yes, that's good to hear these great outcomes. Wow. Well, we went from like 0 to like 50 with our questions. It started off with like they just flew in there. So if we didn't get to your question today, we'll send you an email reply. Thank you for everyone just jumped on the question part.
Is there one quick question?
Well, let's see. Let's see if Brenda can shoot us one quick question. If you have,
one quick. What that's not gonna. I'll just
a yes or no question. It'd be like yes, no.
Yes, no.
We should just have a yes, no for a yes, no segment. That'd be awesome.
Yeah, birds are fantastic animals. Yes, yes. They're wonderful.
Actually, this one kind of ties back to the very beginning of our conversation. Can avian flu spread by mosquitoes?
It's not. That's not a primary route.
That's a yes or no.
So I would say no. I would say no. Let's say no.
Okay.
But yeah, I'm going to say no. That's not the primary route, and so.
What is the primary route of bringing avian flu into your house?
It's kind of respiratory. Is the primary route, and then also fecal and within the environment. Okay. Yeah. So it's not going to be hematogenous like, say, West Nile or something like that.
So let's say you're on a farm and you stepped, walked around, and then you came home and it's on, you walking in your house with your shoes like that.
It would be possible. It would be possible if there was a contamination there. Yeah.
Okay.
Yeah.
Maybe
so yeah.
Change your shoes and maybe.
Yeah. On that. Yeah. But mosquitoes, I would say no. Yeah.
All right. That I like that. That was like a yes or no answer. So yeah. Another one. Let's see.
Yes, but thank you, everybody, and a great webinar again. Thank you.
Right, there we go. It's great to be back with you in 2023, answering some valuable questions that and I got announced today's giveaway winner. So that is going to go out to Fraser Loomis. You get the pellets, part of our 50th anniversary, as well as another Lafeber product of your choice. So congratulations. Yay.
All right,
And
fantastic.
then let's see, a sneak preview, because we have I cannot believe we will be back in March. March is like literally just around the corner. February is the shortest month of the year, right?
Yeah.
So when we march into March, we're going to be back. We're going to be on with Dr. Stephanie Lamb with her Avian Vet Insider series, and she's going to cover, I'm sure this is to be a very popular topic, pet bird hormones, the top 10. So
Well, there you go.
we're heading into spring, right? And
Yes, yes.
I'm going to also, so that's on March 17th. So wear your green, St. Patrick's Day. And also don't let Arroyo know this, but it's Arroyo's birthday, her Amazon's birthday. So we're gonna have a surprise birthday unveiling for Arroyo. So everyone don't tell Arroyo. He has no clue. We're gonna have his little birthday surprise during our webinar on March 17th. And might be some giveaways associated with that. So tune in, find out.
Well, there you go.
Yes.
And,
All right.
and I think when was ours? Like I think in March, the 24th. Yeah.
Yes, you could still wear your green, we'll continue the because you're going in from Mardi Gras, into St. Patrick's.
Yeah, I was thinking of wearing some beads. I have the beads back there, but it is Lent, so I just, if it was before and this could be before Mardi Gras, because it's always 40 days before Easter or something like that. Yeah. So,
all right. So just for the record, Arroyo is going to be 9, the big 9.
9. Ooh.
9, yes.
All right. Well, look forward to that.
Yes. All right. And then we will, oh yeah. So I'm sorry, just getting some more in detail about that from Brenda. So Arroyo is going to open a gift from Lafeber and we can see what he got, like the big unveiling, right? Maybe he'll just rip it open with his curiosity, because he's very, very curious parrot. And so it'll be fun. And some extra giveaways. Yes, we will have extra giveaways for viewers. So join us for that. And all right. So on that note, we will see you back in March, Dr. Tully.
Look forward to it. Look forward to seeing everybody and getting some more good questions.
Of course. Yeah, we all look forward to these. So thank you. And on that note, everyone, have a great weekend. All the best to everybody. Stay safe and have a wonderful weekend. All right.
Yes. Bye-bye.
Until next time. Bye.